So we were asked to review the services of the hospital, and as part of that we managed to get all the teams together, and what we did is we looked at the part of the service that would be changing, so we wouldn't be allowed any visitors in, and we looked at what the needs of the patients would be and what the needs of the families would be. And what came out of that was a communications team at Tewkesbury Hospital who were able then to provide that service and provide comfort to relatives and patients within the hospital.
I was really concerned from an organisational perspective that the new restrictions that we've sadly had to put in place for COVID-19 would have such a damaging and negative impact on family contact. So it was essential to us that we had alternatives. We already had iPads and mobile communications available, but this has been a much required opportunity to try and embed that into day-to-day practice.
Currently, I'm working in the communication team at Tewkesbury Hospital, supporting families and their loved ones whilst visiting restrictions are in place. So the main purpose of the role is to provide really sound communication between relatives and their loved ones. That means that on the morning I will go up to the ward, I will have a thorough handover from the girls who've been looking after the loved ones. I will return down and I will make calls to those relatives.
We're also able to do WhatsApp or Skype or FaceTime calls, so they are able to see their relatives and patients are able to have as close to visiting as possible.
And sometimes families ask us to read poems to their loved ones or prayers, and people read prayers out. The community have knitted lots of hearts that we give to the patients. One goes to the patient and one goes to the family.
The League of Friends have been very, very supportive of our challenging times, and they've provided 10 iPads so that we're able to reconnect people.
So this sort of work is important, obviously, so the patients can still contact their friends and family while visitation isn't possible. We managed to use our pre-existing stock of iPads. We've also had a few donated, and we've been able to buy in a few more as well to sort of meet the demand for our hospitals.
So what we've been doing at Cirencester here is trying to be as personalised as we can in our care. We are trying to ensure that if the family do ring up, it's actually the nurse who's looking after the patient who's speaking to the family, so that they can ask direct questions about what's been happening with the patient, and the nurse themselves are able to say first-hand how the patient is. We're also using technology like they are in a lot of community hospitals in Gloucestershire. So we're using iPads, we're using Messenger, we're using FaceTime, etc. One of the other things we're doing is asking families if they'd like to, they can bring up goodie bags. So that might contain things like their favourite newspaper or their favourite sweets or a magazine that they usually get, something like that, and we will pass that on to the patient so they're able to continue with some normality whilst they're in hospital. We understand that although we're busy, it's really important to sit with patients and talk to patients, and that's something that families would be doing if they were visiting. So we're trying to take some time out to do that. We've got some redeployed staff who are helping us with this, so we are sitting with patients and talking to them as we would do during visiting time.
From a patient's point of view, psychologically, not having any contact at all with their relatives or friends, it does lead to depression and low mood, and just simply knowing that the relatives are in contact, we have found that that has bolstered the patient themselves.
Well-being and physical health goes hand in hand, and actually it really helps the patient's recovery if they can actually keep in touch with their relatives. But also for the relatives at home, they're very anxious, very worried. They need to be able to keep in contact with their loved ones and find out what's going on. So it's a really important service to enable communication and let everybody stay in touch.
We've had some really good feedback. Just a minute ago, actually, I just spoke to somebody and he said how actually it's really helping his mental health knowing how well his mum's doing. Because we're able to give a daily update of what's going on, whether they're getting better, having a good day, bad day, what their mental health is like. We actually helped his mum over the weekend with a conversation on the iPad, so that was really good for both of them. You know, it really, really helped his mum's well-being, being able to see her son and her daughter-in-law, and it helped the family know that actually his mum's safe.
So a lot of us are away from our families at the moment and know how difficult it is. So we can only empathise that with the families who can't come in and see their loved ones who are unwell at the moment, and vice versa. Especially working with dementia, it might be that, you know, they communicate better with their families, so we can learn a lot from the families to be able to help them while they're in hospital with us, and their motor and process skills. There's so many benefits from an occupational therapy perspective of working with patients and families, even if it's unfortunately at this moment through a virtual world, really.
What we're trying to do, particularly at the moment, is to genuinely demonstrate care and what care means within a very restricted context.
Yeah, so it feels really good being able to support patients and their families to be able to still communicate in this difficult time.
Sometimes it is really difficult. The family members do get really upset because they can't see their relatives, especially when they know that they're getting poorly, because sometimes the information we have to give isn't what they want to hear when they're deteriorating. But we're there to support them through that.
So we've seen anxiety reduced by relatives, we've seen anxiety reduced by patients, and people have started to relax a little bit.
Families have said that they wouldn't have been able to cope without the support that we've given them.
We've had excellent feedback from the families. They're very sincerely grateful to us.
It's a hard time and it's a sad time, but being able to do as much as we possibly can to support the patients and the families just makes it worthwhile.